all of us will experience problems with our sleep. And there are lots of bits of advice that are all good advice for how you can improve your sleep, but trying to follow all of it together can make people start to think, oh my goodness, I don't do this every night. Does that mean my sleep is really bad? Does that mean it's bad for my brain?
You can train yourself to need only 4 to 5 hours of sleep.
That is not true.
Snoring is harmless.
That's a difficult one.
Can make up for lost sleep on weekends.
Yeah.
Why is it that we don't have a drug that can make you fall asleep and then the brain would carry on those same physiological things that happen every night whenever we fall asleep?
Yeah, it's a really good question.
Welcome to the podcast, Dr. Tom Smejka. Thank you so much for being here.
Thank you for having me.
I chose the topic of sleep because it seems to be really one of the pinnacles of good health, mental health, brain health, health in general, longevity. And it seems like we cannot really go for long without good sleep.
Right.
And I wanted to ask just a question. Why is that?
Well, yeah, generally speaking, sleep is such a fundamental aspect of our lives. It's something that most of us do 8 hours every day, or at least we try to. The reason for why it's so important for our health is that it has multiple different roles in our longevity. So one of the roles of sleep is regulating bodily functions, so your organs' abilities, so regulating heart rate and detoxifying aspects of the brain. So that sort of general sort of restoration is an aspect of it. It also plays a massive role in our functioning the following day. So that feeling of well-restedness is something that we need in order to then do any of the activities that we want to do during the day. So if we've not slept well, that means we can't function very well. We then potentially, looking at this from an evolutionary perspective, wouldn't then be able to go out and find food sources. We'd be more vulnerable to threat. So it's really a recharging of the battery that then allows us to do everything throughout the day.
Right. And why do we need 8 hours? It seems like such a waste of time to be spending like a third of our lifetime sleeping.
Indeed, yes. 8 hours is a long time. There are some people who've said, I think it's Matthew Walker often quotes, but I don't think it's him originally, that if sleep is not necessary, it would be the worst mistake that Mother Nature ever made in our evolutionary history. In terms of sort of addressing the 8 hours thing, not everybody does require 8 hours of sleep. That tends to be the average when we look at longitudinal data for people and lifespan. There seems to be generally between sort of 7 to 9 hours is what's recommended for adults. The reason why it is so long is because we engage in a number of different sleep cycles. And as mentioned before, each of these aspects of sleep, there are many roles to it. And we need more than one sleep cycle. So essentially, whilst we're engaging in things like REM sleep, so while we're dreaming, we consolidate a lot of the memories from the day. But when we've had 16 hours perhaps of wake, that's a lot of memories that we have to then deal with. So that's why it would also take a long time to restore that aspect of the brain and then sort of consolidate those memories. Because we've been recording for so long neurally, we then also need quite a long time to recover from it.
Okay, that makes sense. But so we need sleep for memory consolidation. We need sleep for our immune health, for brain health in general, to get rid of toxins and I suppose dead cells as well. And what happens if we don't get those 8 hours, and not just for one night, but if we don't get them consistently, what will happen?
So to take a really, really extreme version of this, so if you stopped sleeping altogether, death would actually be the outcome within not very long. So there is a very rare genetic disorder which is sometimes called fatal familial insomnia, where people lose the ability to initiate sleep and they die usually within about 10 days of that taking effect. So in the acute sense, chronic sleep loss ultimately leads to death. In general, when we talk about sleep deprivation, we're not talking about a total loss of 8 hours of sleep over and over again. We're talking about losing 1 or 2 hours of sleep repeatedly. So different things happen depending on what sort of type of sleep people miss. So if you miss a lot of REM sleep, this could then impact your memory performance. Generally, we see that there are associations between development of dementia and chronic sleep loss, meaning the sort of repeatedly losing 1 or 2 hours of sleep. So it seems that most of our sort of general health will start to deteriorate, and you see that people who chronically get sort of fewer than 6 hours of sleep die a lot earlier than people who manage to get at least between 7 and 9 hours kind of consistently throughout their adult life.
Wow. And if somebody just cannot get 8 hours of sleep, what can they do to make sure that those 6 hours are really a good 6 hours of sleep?
Well, I think the first thing that is important to work out is how much sleep you actually need, because it could be the case that you are a person who doesn't need 8 hours sleep to thrive and to be healthy. There are people who will be fine with 6 hours sleep. Not the majority of us, certainly, and I think we should all be wary of these sort of influencers who talk about getting up at 5 a.m. every day, also going to bed late, that sort of this lifestyle of being up and working nonstop. The first thing is working out how much sleep you actually need. You can do this usually by assessing when you've woken up. If you were able to fall asleep before, say, 10 a.m., very quickly, within 10 minutes, if you could fall back to sleep, then you might be a bit sleep deprived. And if you're unable to function optimally without caffeine before midday, that's another indicator that you might need a bit more sleep. So once you've find out how much sleep you actually need, working out how you can get the most out of that sleep that you get is usually based on having a consistent rhythm. So making sure that you have a set bedtime and wake time each night, each day, will be the easiest way to make sure that your body and your brain is expecting sleep to occur at a certain time point. That means that your systems start to expect sleep to come, you start to get sleepier as the time increases towards that bedtime. That means you'll be falling asleep more quickly, more consistently, and then you'll be having usually also a longer sleep without interruptions. The other thing you need to do is to try and prevent interruptions, so making sure that you've been to the toilet before you go to bed so you're not interrupted by that in the night, making sure you're in a dark environment, a quiet environment, and a cool environment. So around 18 degrees Celsius is the optimal temperature for sleep. So if you can sort of consistently have these things in your sleeping environment, that means that you won't have that sleep interrupted, and that will get the most out of it.
And for new parents who are consistently lacking sleep, like maybe for a year after they have a newborn, what would you advise them to do when their sleep is really fragmented, when they can't really get a good sleep schedule down, and everybody says sleep when the baby sleeps, but that's really impossible. It's really hard to do. So what would you advise new parents?
Yeah, so a disclaimer, this goes really beyond my sort of area of expertise, but sort of piecing together things that we sort of understand from sleep science in general. First of all, I would say listen to the experts, listen to your nurses and the people helping you. But beyond that, the idea of sleeping when the baby sleeps may work early on, perhaps, if you don't also have other things that you need to be awake for. But unfortunately, you'll be fighting against your own circadian rhythm, meaning that you will feel a natural tendency to want to sleep when it's dark and to be active while it's light. Regardless of the fact that your baby actually needs lots more sleep than you do, you still also want to be trying to aim to meet the amount of sleep that you need. If you're kept up in the night, having a daytime nap might then be appropriate to kind of compensate for some of the lost hours. But if you were to actually sleep the same amount of time as your newborn, you'd be sleeping for about 16 hours in the day, which goes beyond what you actually require. So one thing that's quite important is that if you are napping during the day, you want to try to avoid it from being too close to when you would otherwise want to go to bed at night, because otherwise you might remove some of your sleep pressure, and that would make it a lot harder for you to fall asleep when you then want to. So if you are napping in the afternoon, the general advice is for everybody, as well as new parents, to try and aim them to be about 20 to 30 minutes long, and you want to do that in the early afternoon between sort of 1 and 3 p.m. So that you can then build up enough sleep pressure again before the evening.
So if you get, let's say, 2 hours of sleep in the evening, and then 2 more hours in the morning, and then 3 to 4 hours in the afternoon, that will be fine for your brain. It will be able to catch up.
It's very difficult to say, because we know that people tend to rate their sleep quality as being best when it falls within their standard routine. So even if you were able to piece together 8 hours of sleep around the day, it's difficult to say whether that would be the same level of use for you and sort of for your brain health. One thing I would say is that you can often listen to your body and recognize when you're just meeting that level of exhaustion. If it means that you have to lie down and have a nap, you can just listen to yourself. One of the things that I think is really important when you listen to a lot of health advice in general, but particularly about sleep advice, is that it's quite scary, because all of us will experience problems with our sleep. And there are lots of bits of advice that are all good advice for how you can improve your sleep, but trying to follow all of it together can make people start to think, oh my goodness, I don't do this every night. Does that mean my sleep is really bad? Does that mean it's bad for my brain? The overall advice that I would always try to instill with people is, if you think your sleep is okay, don't listen to any advice on improvement, because you don't need to improve. If you're happy with your sleep, if you're feeling well rested, carry on as you are. Even if that involves you, using your phone in bed, try to be honest with yourself to see, am I actually waking up feeling well rested? Be honest with yourself with that question. But if you are, you don't need to change.
That's good news, because I've had a few sleepless nights these past few weeks, and I came across this video, I don't know if you've seen it, by Bryan Johnson.
If you recently got less than 4 hours of sleep, I have some news for you. When you do that, your NK cells, these are the cells that are responsible for killing cancer, they decrease in activity by 72%. You also have a 400% increased likelihood of getting sick. So when your body does not get rest, even one night of 4 hours of sleep dramatically lowers your body's ability to fight cancer and getting sick. So a lot of people think, oh, it's just one night, I'll make it up tomorrow. It can't. Sometimes it'll take the body several days to recover from one bad night's sleep. If you look at the studies, one bad night's sleep increases a protein in the brain that is equal to a traumatic brain injury. So the brain is experiencing the lack of sleep as though it were harmed in a significant way. A lot of people think you can occasionally have bad night's sleep. It really is a bad idea. It reduces your body's primary functions which keep you alive.
A few things with this video that I think are correct, and then a few things that I think lead slightly more towards fear-mongering. So I think the study that's presented is not one that I've read, but just from looking at the fact that they're looking at 4 hours of sleep deprivation, that for most people is 50% of their night lost, which for most people who have a bad night's sleep is not really reflective of a standard bad night's sleep. That's quite an extreme example. So regarding which factor there that they said also is similar as what's seen in traumatic brain injury, I don't think it's the case that they're saying that you will see neuronal cell death the same way that you would from a TBI, traumatic brain injury, the same way as losing 4 hours of sleep. It is definitely important for you to be sleeping well and for you to be consistently getting that sleep, but to then try and draw a line to say one bad night's sleep is similar to a traumatic brain injury is completely incorrect. There are far more things at play when we have traumatic brain injuries or strokes, things like that, that impact our neuronal health. So I think this is kind of goes back to what I was saying before with the idea of, yeah, sleep is important. It's important to promote that as a good, healthy practice. But telling people that one bad night's sleep might be the same as having a TBI is likely to cause them just anxiety and worry, which ironically are two things that are most likely to stop you from being able to sleep in the first place.
And it's a vicious circle then, where you cannot fall asleep.
Yeah.
Okay. So speaking of traumatic brain injury, you've also done research on how TBI and stroke also affects sleep quality. So maybe we should just lay the foundation first. What is traumatic brain injury? What is stroke? And why would they impact sleep health?
Yeah, so stroke is a neurological event whereby parts of the brain are deprived of oxygen. So the blood carries oxygen to the brain, and if you have either a clot or a bleed that prevent that from happening, the cells are obstructed from being able to receive oxygen and they start to die out. And the cells that die out or decay, that is what a stroke is. Traumatic brain injury is quite similar, but instead of the oxygen being deprived of a clot or a bleed that sort of happen perhaps naturally or due to high blood pressure, it's because of blunt force to the head. So through car accident or a fall, that would then be a traumatic brain injury. But in both cases, we end up seeing damage to the brain tissue, the neurons that then die out. And based on where that damage is, or in general having damage to the brain, different functions are affected. So the way that could impact sleep kind of happens within three main sort of possibilities. One is that a part of the brain that is used for maintaining or initiating sleep is directly damaged. And so then a bit of recovery then takes place in order for people to be able to regain those abilities. Or in some cases, perhaps some of that ability is partially lost forever. Two could be that a different part of the brain is impacted, but that leads to behavioral changes that then make sleep more difficult. So if people have a lot of mobility problems following a stroke or brain injury, that means they can't go back to work, their daily routine might be very disrupted, and then that might impact their sleep routine as well. And then the last one is sort of the environmental or psychological changes that happen with that. So higher anxiety related to experiencing a trauma, or staying in a hospital through recovery means you're not in your natural home environment. So these environmental changes could also impact your sleep.
What would happen if somebody cannot fall asleep? They absolutely cannot fall asleep. They have severe insomnia. And is there anything we can do to help them?
In the case, as mentioned before, with fatal familial insomnia, it's a fatal diagnosis. Unfortunately, there isn't a cure available.
And this is genetic?
It's a genetic disorder. It's very rare,
Okay.
and I've never met a patient with it, as far as I'm aware. But it's something that is quite rare. In terms of people who have chronic insomnia, that's slightly different, because the reasons for why they're unable to initiate sleep go more towards behavioral things or psychological problems that we can absolutely address. One thing that's quite interesting to note is that the Guinness Book of World Records used to recognize the longest time spent awake as a world record, and they no longer recognize it because it's actually quite a severe health issue. So to try and encourage people to be keeping awake is now seen as being something that is too dangerous, so they no longer recognize it as a world record. But there are some things that we do with people with insomnia, which we can discuss if you'd like.
Yeah, of course. What are some of the therapies that you do whenever someone cannot fall asleep? Absolutely. And one of the things I've always wondered is, why is it that we don't have a drug that can make you fall asleep and then the brain would carry on those same physiological things that happen every night whenever we fall asleep? Why is it that we cannot force this on the brain?
Yeah, it's a really good question. And so to start off then with looking at drug-related treatments. So most of the drug therapies that we have are either versions of anti-anxiety medications that have sedative effects, or just general sedatives. And the reason why I call them sedatives rather than sort of sleep medications is that they essentially knock you out rather than promoting good sleep. The reason for why we've not made one yet that is good at promoting sleep, I think, is related to how complex the activation of the brain is during sleep. It's almost a bit like asking the question, why don't we have a drug that we can take that means that we can do everything that we do throughout the day, but without having to make any conscious decisions and allowing everything to go as normal? So while we're asleep, a lot of activity is going on. So any drug that then tries to bring in sedation often interrupts these circuits and these sleep rhythms. The problem then is that people tend to wake up in the morning and they will have been sedated for a certain number of hours of their first sleep. Then natural sleep kicks in, a bit similar to when you drink a lot of alcohol and then it feels like you fall asleep very quickly, but you've actually passed out, and natural sleep kicks in a bit later. Then you wake up in the morning feeling very tired, even though you feel like you've been asleep for a number of hours, because technically your brain was only asleep for a shorter amount of those. So people who are on sleep medications tend to wake up not feeling very well rested, and unfortunately some of them then say, I need to take a high dosage of my medication to help me sleep better, and then that extends the window of the time when they're technically sedated. So a recent review actually now recommends that, I think it's the World Health Organization, the NHS in Europe, and I think the European Health Commission, all say that medications for sleep, these sort of sedatives, should only be in use for 4 weeks, no longer. So that's the maximum amount of time you should be on those. The first line standard treatment for insomnia in particular actually is cognitive behavior therapy. So this is a type of therapy that involves looking at people's behaviors and thought patterns to try and give them a healthier approach to sleep and gives them some behavioral techniques to try at home that make them more sleepy so that they can initiate sleep. So in answer to the question of what do we do with people who really can't fall asleep, well, for one thing, there's a bit of a myth that we all sort of experience where people will often say to you, I didn't sleep at all last night. This is a common thing that you'll hear from your friends. But if you imagine lying still in a room for 8 hours doing nothing, that's actually something that I think for many of us would be an almost impossible task, right? So most of us can't sit for 5 minutes before we need to be on our phone or engaging with something else. So the idea that these same people are saying, yeah, I lay for 8 hours trying to sleep and that maintained my attention for the entire time, it's actually usually not true. What happens is when we're in lighter periods of sleep, we tend to measure this as being actual sleep, as being wake. So we think that we are awake when actually we might be in lighter periods of sleep. This is still not good for us because we also need to get into deep sleep and REM sleep. But it's often not quite right that we've genuinely been awake for 8 hours. So that's one thing, is to often, as also part of cognitive behavior therapy, is a bit of this psychoeducation where we talk to people about what their expectations are for sleep and how things might not be as bad for them already. So basically trying to make them feel a bit calmer. That's one way that we can encourage people's sleep. There are multiple other behavioral things that we can go into if you're interested, but the general thing is cognitive behavior therapy, which lasts usually about 6 weeks. Traditionally is done with a therapist with a weekly session, and they might ask you to keep a sleep diary or something to track your sleep as you also receive this advice and sort of cognitive therapy to make you feel a bit more relaxed about sleep in general.
And something else most people experience during sleep is dreaming. Why do we need to dream? What is the benefit of it for the brain? And why is it that we don't just have dreamless sleep? Wouldn't that be more efficient for the brain? Because otherwise it seems like the brain is doing all this work that we just talked about and dreaming on top of this. And also, are there people who struggle with dreaming? Are there any disorders related to dreaming? Because for me, for example, I have really vivid dreams, and sometimes this prevents me from waking up in the morning and kind of makes me, I feel like my sleep quality is not as good when I have these vivid dreams. So is there anything one can do about that?
Yeah, so dreaming is a really interesting aspect of sleep. Generally speaking, you'll see a lot of people that talk about prophetic dreams, that your dreams mean things for either the future of your life. It's not really a position that I would take, but I do think that dreams may represent something that is happening in our lives currently rather than something about the future. So when we consider what REM sleep looks like, we often see a reactivation of parts of the brain that were active during the day. One of the reasons why this is happening is because we reactivate aspects of the hippocampus, and so that our memories can be stored not within the hippocampus, but then they can be translated to the neocortex, where you have a lot more storage space, if you like. So it's a bit like wiping a memory card so that you maintain that with storage for the next day, and then you put your memories in a larger storage. The reason for why we have dreams is still completely unknown within science, and so my speculations are that what we'll often see is when we reactivate parts of the brain that were active during the day, including anything we've been thinking about, what we also don't have at that time is an activation of our frontal lobe, which normally gives us sort of organization, logical thinking. And so we end up with reactivating a lot of the thoughts from the day with no director of logic or of control. And that's how we end up with some really wacky ideas. So this is perhaps more of a personal position on what I think dreaming might be. But I think it's probably just a byproduct of the reactivation of those parts of the brain, because it would be difficult to activate that part of the brain without any sort of conscious experience. Whether or not that would be more efficient for the brain, it seems not to have been evolutionarily selected out of us. So I wouldn't be inclined to say that it would make things more efficient. In terms of where it goes wrong, is where we end up with people who have nightmares. So if you imagine that if you've been having a lot of anxiety throughout the day, and now we're reactivating all of the parts of the brain that were active, if you've had a lot of anxiety, that might mean that your dream content is particularly scary or worrisome. So we often see that people report nightmares are the same people who report having higher anxiety throughout the day, which makes sense. So this can be particularly an issue if it interrupts your sleep by waking you up. So I'd be interested to talk to you a little bit more about your experiences with vivid dreams, but just looking at nightmares by themselves, one thing that if people are so frightened that they wake up that disrupts their REM sleep, this could be a particular issue for sleep disruption, but we often see it's an issue particularly for people with PTSD. So if somebody has experienced a trauma, when we are engaging in REM sleep, one thing that we do whilst consolidating memories is to remove the emotional weight that those memories have. So while we see an increase in activation of hippocampal regions, we see downregulation of the amygdala. So you're able to remember what happened without feeling the emotional weight of it. But if a nightmare that commonly happen after PTSD interrupts that REM sleep, you're sort of taking away that nightly therapy, if you like. And so then that can increase the longevity of flashbacks and things like that for people with PTSD. But I'm interested in your experiences. You said that you experience vivid dreams that then stop you from waking up.
Yeah.
So does it feel like you become aware that you're dreaming and you want to wake up, but you're unable to? Or
no, it's the opposite, actually. I feel like when I'm in the dream, that is real life. I feel like I am living right now and this is what's happening really. And so because the dreams are so lifelike, I feel like I don't need to wake up really.
Okay.
And it's also, sometimes they're very complex as well. So many things are happening at the same time. And they can be scary, but most of the time they're not.
And so does it actually mean that you end up sleeping in longer than you otherwise
Yeah.
would? Do you ever sleep through sort of alarms, or is it more a thing that tends to happen at the weekend?
Yeah, I sleep through alarms, and also on weekends and on weekdays. It doesn't matter.
Okay. Because one thing that we tend to see is that people who lie in at the weekend are more likely to experience vivid dreams, or that they remember their dreams. This might be because when you lie in, where you sort of wake up and then you fall back to sleep, if there's a shorter amount of time between a period of REM and a period of wake, you're more likely to remember what's going on there. As that might be why we experience our dreams to be either more vivid or more memorable at the weekend. But it's interesting if you experience them to be sort of extra vivid throughout the day. Is this a consistent thing that happens, or is it related to
Yeah.
when there's higher stress in your life? Or
No, it's always been like that.
Okay,
I
so
think
it's
just my
consistent.
brain is wired that way.
Okay.
That I have many dreams, and sometimes it's also things that have happened already. So that feeds into what you said, that we tend to consolidate memories while we sleep. And another theory I've heard, I think Jordan Peterson recently talked about this. It also feeds into what you said about the amygdala, that we tend to have nightmares because we want to get rid of the emotional burden of that thing that's scaring us so much. And then the amygdala tends to, like he said, the opposite. The amygdala tends to fire, but that's because it teaches you that, for example, when you see a bear, you have to have that emotion. And then when you are dealing with this in real life, you know how to properly react so that you can survive.
Right. Yeah. So that relates, I think, into some other psychological theories about sort of the rehearsal idea, that if I can rehearse something in a dream, then I might be more protected later. I would say, to come back against Jordan Peterson on that idea, and I have plenty of things that I would come back against Jordan Peterson on for clarity, but with this in particular, the firing of discussing the brain as if it wants to do something, I think it's often a strange thing when people talk about psychology, as the brain having its own goals separate from the consciousness of the person sort of in the driver's seat. So it's not as such that the brain wants to engage with fighting back against something emotional, as it is that if you've been emotional a lot throughout the day, when you then go to reactivate the parts of the brain that were active there, that is one of them. And so we also know from research where we look at fMRI study while people are asleep, we do downregulate the amygdala whilst we're in dreaming phases. That's one of the reasons why, if you ever have an argument with a partner or a friend, go to sleep, you wake up the following day remembering what they said, but not feeling as spicily angry against them. And this is why it's that downregulation of the amygdala with then the memory consolidation. But that tends not to go so well for people who have had trauma, not necessarily because their brain wants to experience these emotions again, but because they might be strong enough to then interrupt the REM sleep altogether. But yeah, talking about the brain as if it has its own wants is something that is odd when people do that, I think.
Right. And is it true that with people with trauma, and particularly PTSD, I think, the amygdala is larger, like physically larger?
It can be, yeah. So in general, when you use a part of the brain more frequently, it grows in size. So this is the aspect of neuroplasticity. If you spend a lot of time ruminating on something emotional, that potentially could increase the size of the amygdala. One thing that I am more aware of is just the hyperreactivity of it, so that even if it's not increased in size, it would take perhaps less of an environmental stimulus to trigger an emotional response. But this is something that we also experience when we're sleep deprived. If you're tired, it's classic that people are very grumpy and aggravated when they are sleep deprived. It's because we have a negative preference for stimulus when we haven't slept so well. So it could be the case that this is for our survival, that if you are otherwise cognitively slower and sleepy, if there were a threat in your environment, you need to respond to it more quickly. So that could be one of the reasons why we have this sort of negative bias when we're sleep deprived. But that's also something that could be related within PTSD as well, if people are not sleeping so well.
But that makes sense, because then you're in a vicious circle of not being able to fall asleep, not being able to control your emotions so well, to downregulate. And then the amygdala is firing more than it should be. and then you
Yeah.
can't sleep again, and then you're stuck with the insomnia, and kind of the PTSD seems to even worsen over time.
Yeah, exactly. And it's interesting actually how, unfortunately, so many of us, around 50% of us are predicted, or at least it seems that about 50% of people in their lifetime experience a traumatic event, but very few of those people go on to develop PTSD. So there is something related to the psychology of certain individuals that then might lead them on to that experience, whereas others who experience similar traumatic events won't. And so then within therapy, trying to target what that might mean about somebody's underlying anxieties, and if we can get to those and try and work on that, we might be able to make people slightly more relaxed, particularly at bedtime, but throughout the day, desensitizing them to some of the stimulation that or objects and sounds that might be related to a traumatic event, that then mean that they can spend less time thinking about it throughout the day. That might also mean that they spend less time thinking about it at night as well.
And I think those people often turn to substances to be able to fall asleep. But as we already discussed, that's not really good for your brain, because then you fall unconscious, but you don't really engage in all of these. You don't engage in the memory consolidation and the downregulation of the amygdala and all of these physiological processes that you need to keep your brain sharp and healthy. So yeah, it's a difficult one, right?
Yeah, and there is something now that I'm not sure if this is used so much for people with PTSD, but there is a newer aspect of a behavioral practice that we use called sleep restriction therapy. So this is a behavioral component that could be within cognitive behavior therapy. Although it is so strong in the way that it works, it's now also being used sort of as a first attempt. So what this involves is basically chronically making somebody so tired throughout a week that they're able then to, regardless of any anxieties or worries or bad thoughts that they have about sleep, they will just fall asleep because they're so tired. What you end up, how it works is that you take somebody who, let's say they are in bed for 10 hours, but they only sleep for 6 hours of that. You reduce the window that they're allowed to be in bed to 6 hours. And then you make sure that they try and, so they get into bed and they're getting out of bed 6 hours later, regardless of how much they've been sleeping. You keep them on this schedule until their sleep efficiency, which is a percentage score of the amount of time that someone's in bed that they're actually sleeping. So you keep them in this sleep window until their sleep efficiency reaches around 90%, and then you might extend the window they're allowed to be in bed by half an hour. And you do that again until it reaches 80%, another half an hour, and you keep doing that window expansion until they get back to their regular rhythm of how much sleep they really need. But it's a difficult therapy. I had a participant once in a study who I saw sort of 1 week at the start of a sleep restriction therapy and then again at the end of the week. And she told me she had her first good night of sleep in about 10 years of chronic insomnia. But she said, had you arrived on Thursday instead of on Friday, sort of like the 2 days before, however long it was, she said, I would have told you to go and fuck yourself, because she was like, I was so tired by that point. I was so deprived of sleep, so annoyed that she thought I nearly gave up, nearly called you up to tell you where you can shove your research. And she said I stuck with it, and she ended up having a first completely uninterrupted night's sleep.
Wow.
So she was
8
then
hours fully.
Yes,
Wow.
yeah. When previously she'd found it very difficult to maintain sleep throughout the night, but that build-up of sleep pressure over time can be something that it's quite a, not severe is probably the wrong word, but it's quite an intense treatment to undergo, and so tends to be only for people who have chronic insomnia who've tried other things that haven't worked. But it's a bit like hitting a factory reset on your brain to get you back into those healthier sleep patterns.
How long did it take her to get that full night of sleep?
So that was within, I think I must have seen her. So we set the people up on the study. I think she said it was sort of within 1 week that she had her first sort of full night's sleep. So I think she probably started on the Monday, and then by sort of day 4, then she had experienced a full night's sleep. It doesn't mean that the problem is solved completely. You then have to have night 5 and 6 and so on. But for one thing, it's very nice for people to see that they can once again get back to a normal sleep routine. So just having one night to show them that it is possible that they'll get better might be enough to make people feel comfortable.
I'm just curious, with her, what was the problem? So she had insomnia, but was it because of an anxiety disorder or something else?
So she had a stroke as well. So that was one of the reasons why we were doing this bit of research. We were looking to see if a digital version of cognitive behavior therapy that had been shown to work for people with insomnia would also work for people who'd had a stroke. So I also did some interviews with people before and after to talk about their experiences. But no, she'd had sleep problems for a long time that had then become exacerbated by the stroke. And so that's why.
Does it matter where you have the stroke? For example, if you have the stroke near the pineal gland, which is the gland which regulates melatonin production, I guess it makes sense. But if you have stroke near your visual cortex, for example, would that also cause sleep problems?
In theory, any aspect of damage to the brain might cause aspects of, say, something like fatigue, which is not the same as as being tired in the standard sense. But if you have visual problems that mean that you then can't go to work, you need to engage in rehabilitation. Anything that disrupts your sleep, your daily rhythms, could then also interrupt your sleep pattern. So while neurologically speaking, there might not be anything preventing your brain from initiating sleep, behaviorally, you might prevent yourself from meeting a routine that you find relaxing enough to initiate sleep.
Right. So we talked quite a bit about insomnia, but I'm also interested in hypersomnia. And is this also as damaging to the brain as insomnia? I would guess not, but you will be the one to say.
Yeah.
And also, are there any treatments for it as well?
So it's a good guess. No, hypersomnia, generally speaking, is not as bad for you as insomnia. One of the reasons why hypersomnia sometimes is a bit muddy in data analysis is because people who have terminal illnesses prior to death tend to sleep for long periods. And if this is being recorded as something that goes into sort of a data pool, you might see that there's an association with people sleeping 12 hours a day and then very swift mortality. But it's not because of the 12 hours of sleep, it's because there's a separate disease that is making them sleep so much. So that's one of the reasons why some of the data analysis and looking at the relationship here can be difficult. Generally speaking, when we look at, there's quite a nice graph that shows the mortality rates of people based on the consistent average number of sleep they get per night. And you can see that the mortality is much higher for people who are in the sort of the 4 hours a night range compared to people who are 12 hours per night. Their mortality rates are slightly higher, so they die earlier than people getting sort of between 7 and 9, but it is not to anywhere near the same degree as people with too little sleep. It ends up being something that can be quite frustrating for someone socially. And so if it's the case that they want to try and reduce the amount of sleep they get, one of the things that's important to recognize is if you need your 12 hours of sleep to function correctly, unfortunately, that's the amount of sleep that you are going to have. With insomnia, if it's the reason why it's a disorder is not because of the fact that you're getting too little sleep, it's because you're getting too little sleep than you need. So if you're a person who would only need 5 hours of sleep, you would not be considered an insomniac. If you're a person who needs 10 to 11 hours of sleep, you don't necessarily have hypersomnia. So it's only in the cases that you're sleeping too much when that's not as much as you need. And in those cases, we might look at behavioral practices where people perhaps keep themselves awake too long and then they sort of disrupt their own circadian rhythm. So they're sleeping outside of the phase of when it would be optimal for them to be sleeping, which then makes them wake up being a bit more tired. And if people have the opportunity to lie in, they might take that opportunity, thereby pushing their sort of sleep rhythms a bit out of whack. So that might be one way that we would address that at first with somebody. But hypersomnia generally is not really something that I investigate that much. And for people, again, if it's something that is not impacting your life negatively and you are only feeling well rested when you're getting between 10 to 11 hours, say, that's unfortunately for you. That's what you need.
Are there people who need just 5 hours of sleep, really? I'm so jealous.
Yeah,
I wish I needed
theoretically,
just 5
there
hours.
are, but it's a very, very small percentage of the population, much smaller than the population who claim that they only need 5 hours of sleep. For some reason, a lot of old British prime ministers have bragged about how little amount of sleep they require. I think Churchill used to say that he only needed 4 hours of sleep. Margaret Thatcher, I think, used to brag about only needing 5 hours of sleep. However, she then later went on to die of dementia. So whether or not this is somebody who really needs that amount of sleep or not, you don't have to feel bad for Margaret Thatcher. She did a lot of other very nasty things. But generally speaking, the people who sort of brag about this, it's very difficult to know if they really need that or if they're just claiming to get by without it to make themselves seem more productive than the rest of us and make everyone else feel bad. You shouldn't feel bad about needing the amount of sleep you need. It's an aspect of your life, and it's also a rich experience that a lot of people enjoy. So you should take it when you can.
Is it genetic how much sleep we need? Because I need to have my 8 to 9 hours of sleep. Otherwise, I cannot function. If I have just 6 hours one night, that day will be horrible for me. And for someone else, it's just 6 hours. It's perfect.
Yeah, natural variability in sort of how much sleep we need and also when we need that sleep. So if we're morning types or evening types, does tend to be something that we see as being genetically determined. Whether or not you're able to get by with 1 hour of sleep lesser here or there, it doesn't seem to be a thing that you could behaviorally teach yourself to get into. So unfortunately, that's not something you should try by just slowly reducing the amount of sleep you get each night until you're at a small number. You need to be honest when you listen to your body and think, okay, am I actually well rested enough? And that tends to be related to genetic factors for how much you need.
Going back to Margaret Thatcher and dementia, should we explore a little bit the relationship between having less sleep for a prolonged period of time? I've heard that even if you get less sleep in your 20s and 30s, then your risk of dementia later on increases significantly, which is unfortunate because in your 20s you want to go out, you want to party a lot. So many people do that. So what is that relationship and why does that happen?
So particularly with Alzheimer's disease, we see that there's a relation between the buildup of these amyloid beta plaques that build up within the brain. During sleep, some of these plaques are cleared out. So that's one of the reasons why there's a relationship between chronic lack of sleep and then particularly Alzheimer's disease. It's not the only thing that contributes towards it. It's not the case that if you have 1 or 2 nights of bad sleep, it means you're going to get Alzheimer's disease. That's absolutely not the message here. But chronically, that might be one of the reasons why, because the brain is not able to sort of detoxify, clear away these plaques that it would be doing during sleep. And that could then lead to a later onset or an earlier onset of dementia.
And is that also true if you have to work night shifts, for example, and then you try to catch up on sleep during the day? Because I assume there should be some kind of reason that we sleep during the night when it's dark outside.
Yeah, so night shift work is a really interesting and difficult area of sleep research because it seems to be the case that nobody ever neurologically adjusts to night shift work. And it's a real shame that it's not really more understood the complexities and the difficulties with shift work, because it tends to be that the jobs that are really vital that we make people do during the night. And so these are also people who deserve more of the respect of research funding and health information to tell them, okay, maybe you cannot sustain this job for a certain amount of time, and we could be better at swapping people in and out of that position. Because of the way that sleep is initiated and sleep works, we have 2 main processes that contribute towards our ability to initiate sleep. So the first is the circadian rhythm, and that is basically the sun is in control of that. So when it's light outside, as non-nocturnal animals, we are alert and awake during the day. Then as it becomes darker, we then start to initiate sleep. That's related to increased production of things like melatonin as light starts to go away. But that's kind of related to also the fact that as non-nocturnal animals, that's when we would then be going out to get food, to hunt, to build shelters, and so on. Our eyes are not really built for the dark, so evolutionarily speaking, that's not something that we would be able to maintain. The other process that's involved in that is the homeostatic process. So that's your sleep drive that builds up as you're awake throughout the day. So when our brains are active, one of the byproducts of that is so the energy that comes off is adenosine. And so as adenosine builds up throughout the day, we then start to become a bit more tired. So I believe adenosine is actually the byproduct of the breakdown of the glucose within the brain. Brain is active, there is then the breakdown, and so the byproduct of that breakdown is then adenosine. Oh, okay. That can then be mitigated by caffeine, because caffeine binds to the receptors that adenosine would otherwise bind to, and that's why you then don't feel as tired when you've been drinking caffeine. But in terms of shift work, because you can change your sleep drive depending on, let's say I slept throughout the day, I won't have much of a sleep drive. I still will have a circadian rhythm that is going on telling me it's time to go to bed when it's dark and it's time to get up in the morning. So the misalignment of those two things never goes back into alignment when you do night shift work. Similarly with jet lag, that's kind of the same misalignment of your circadian rhythm and your sleep drive. And so it's important that people are able to maintain certain rhythms, but that they don't do too many nights in a row of night shifts without being able to try and get some restful nights that align to their circadian rhythm and to their sleep drive.
So is that to say that no matter how much sleep you get during the day, when nighttime comes and it's dark outside, your brain will get that signal, you need to go to sleep now?
It's not the case that if you have completely wiped out your sleep drive by having those 8 hours, that you will then also be able to initiate sleep later. It's one of the reasons why napping throughout the day can stop you from being able to sleep at night. It's more an issue that if you're sleeping throughout the day, when your brain is getting that signal that it's time to wake up, it might also raise your core body temperature, and you might be more likely to have disrupted sleep in that sense. There's also more environmental noise that could disrupt your sleep. We do tend to see that people report having a lower sleep quality when they've slept throughout the day compared to when they slept at night, even if they felt really tired before going to bed as well. So that's one of the issues with night shift work and then trying to catch up in the day.
Right, so if somebody wants to really take care of their brain and have the optimal sleep schedule, what are some of the things that they can do to ensure that they get a really good night of sleep every night?
So the main top tips, the first one is just consistency. So go to bed at the same time every night, wake up at the same time every night. That includes the weekends. So a lot of people will be somewhat sleep deprived or getting up earlier because of alarms for their jobs. And then they think at the weekend, great, I can sleep in. But then that means that you then tend to not be able to go to sleep as early in the evenings of the weekends. And then when it comes back to Monday, you find it really hard to get up. If you're sleeping enough, getting up at the same time throughout the week and at the weekend will not be a problem for you. So consistency is number one. The second one is trying to make sure that you are tired before you go to bed. Trying to keep your bed as only a place where you are ready to engage with sleep. So don't have food in your bed. Don't spend too long on your laptop or on your phone in bed. Again, all of these things are related to how to maximize your ability to sleep consistently. So if you do this, but you're sleeping fine, carry on. Making sure that if you have a pre-sleep routine, you do it in the same order every night. That can be a way to sort of start to condition your body to become more tired. So if you get changed into pajamas, getting undressed, brushing your teeth, these kind of things, do them in the same order every evening. And that will then tell your body, okay, sleep is about to happen. If you are, some other things that you should try to do is the general health advice. So try and get some exercise within the day, but don't do it within 2 hours of when you want to fall asleep. The fact that your body temperature will be much higher when you finished with exercise means that it might be harder for you to fall asleep because the body has to drop its temperature by 1.5 degrees Celsius in order to initiate sleep. Similarly, don't have your evening meal within 3 hours of when you want to sleep because having a lot of food and energy that's being digested might be something that keeps you awake. Generally, try to avoid alcohol and smoking, unhealthy foods, all the things that make life worth living in the first place. But try and do these things in moderation and not too close towards bedtime. So generally trying to keep a healthy routine, be consistent with your sleep times, and try and keep your pre-sleep routine a set routine.
Speaking of food, how does food impact sleep? And is there anything that one should avoid in the evening? For example, if I have a huge piece of chocolate cake 2 hours before I go to bed, will that huge glucose spike impact my sleep in a negative way?
In general, any amount of food or large amount of food consumed close to when you want to go to bed is not a great idea, regardless of what it is. If you're really hungry to the point where you can't fall asleep because of your hunger, then you might want to have a snack because that's a separate issue. One of the things that we know with foods is where there's hidden caffeine. So dark chocolate, if it was a dark chocolate cake, that will have caffeine in it. So that's something that people aren't often aware of. Breakfast cereals do also have caffeine in them. Interestingly, though, although we often say to people, try to avoid caffeine and don't have make sure your last caffeinated drink is at least 5 to 6 hours before you want to sleep. There are plenty of cultures where people have an espresso after dinner. If you're not that susceptible to caffeine because of a certain tolerance or whatever, then don't worry so much about that. But if you're particularly susceptible to caffeine, avoid things like coffees, and green tea as well. There's more caffeine in green tea than there is in a cup of coffee. So there's a lot of hidden caffeine to look out for. Similarly, if you have cold and flu, taking sort of flu medication will also contain caffeine. So if you can find a nighttime version of it that doesn't have the caffeine in, that's also something to account for. In terms of foods in general, with certain properties that might be good or bad for your sleep, from some reviews that I've done of articles, it's very difficult to ever ascertain what aspects of the ingredients are driving towards sleep, because they don't usually tend to control for dosage or body weight. So I wouldn't worry too much about avoiding particular foods as good or bad for sleep, but just try not to engage with them too close to when you want to go to bed.
And when I've had trouble sleeping, I've just looked at the internet at general advice. And some people say, if you eat pistachios in the nights, you have less difficulty falling asleep because they contain melatonin. Or it's the same with cherries or other types of food. Mm-hmm. And I assume this is not as effective as taking, for example, a melatonin pill, supplement. So what's your take on that?
One of the issues with looking at melatonin supplements and substances that contain melatonin, for one, with the foods, it's very difficult to know how much of a substance that, even though it might contain it, how much you then absorb and then is then going to be utilized within your brain is also going to be changed depending on an individual's metabolism. One of the problems with melatonin supplements in general is that people usually take them when they're struggling to fall asleep, but many of them only have their effects 6 hours after you take the melatonin pill to spike the levels then. So it's actually something that would usually be used for people to try and regulate their sleep rhythms, their circadian rhythm, back to a stable routine, and then you need to pre-plan when you're going to take it. If you take a melatonin pill when you are not able to sleep, and it won't help you, but what it will do is spike your melatonin 6 hours later when you probably are already going to be asleep, and that might make it harder for you to wake up in the morning. So all of the supplements vary in their onset time. So if you are taking melatonin supplements, it's really important that you know that timing onset, and it's not something that you can just take one as a way of engaging with making you sleepy at the time beyond perhaps a placebo effect. It might have more effects if you take it where you time the melatonin to occur as the sun is going down, so that you can then try and engage with the sort of the regular circadian rhythm as you would normally get by the sun.
And is it useful to take that for months, or is there a point where your brain has so much build up and has grown accustomed to it that it stops working?
So for the taking of melatonin, it should be to re-regulate your circadian rhythm, but there are other things in your environment that give you these cues for when the time is. So it's not something that you should then need to be taking forever, because melatonin secretion increases as things get darker. So if it's the case that you've been spending a lot of time around very bright lights into the evening, and that has delayed the onset of melatonin, taking some pills might help to alleviate that. Similarly, for jet lag, you might be able to make the effects of jet lag not be as severe if you take melatonin for a short period, but it's not a substance that we'd recommend to be on forever. It's just to reset that rhythm, and then utilize the sun, utilize daily activity as a way of giving your body that indicator. Today it's daytime right now, and then it's nighttime right now.
Andrew Huberman recommends waking up and seeing the sun first thing in the morning, and then whenever you want to go to sleep, just being exposed to as little light as possible. Does that feed into that natural circadian rhythm that we have, and is that something that you recommend as well?
Absolutely.
Yeah.
So one thing that you might notice even subjectively is that if you're able to, if you can bear it, to open the curtain in the morning when you're feeling very tired, you'll notice that actually you start to wake up subjectively a lot quicker when you're exposed to sunlight and bright light in the morning. So this is something that I absolutely would recommend. It also helps to regulate your circadian rhythm, because it then starts to deconstruct any of the melatonin that's being produced, but also to then set you up for the rest of the day. Similarly, trying to avoid bright lights in the evening is another good way to engage with keeping your circadian rhythm set to the sun rather than to your phone or the office lights or whatever.
And if you're living in a country where you don't really see the sun a lot, what can you do in the morning to really wake up?
Yeah, so certain light therapies are options for people who live sort of in the Nordic poles, that sort of, those areas where sunlight is really limited at certain times of the year. Trying to artificially stimulate your circadian rhythm is something you can do with the absence of the sun as your sort of central clock. So that would be, instead of opening your curtain, gazing into a bright light early in the morning, and then making sure that light is given to you throughout the day that then can be switched off. Because one thing that works quite nicely for the production of melatonin is contrast. So if you've been inside all day without access to the sun, it might be the case that being on your phone at night has more of a problem for you than if you were outside in the day around bright sunlight. And then even if you're on your phone at late at night, it's still going to be relatively a lot less light than it was before. So you're still able to produce melatonin.
What's your take on wearables? Do you think everyone needs a clock to really see if they got enough deep sleep, got enough REM?
So absolutely not everyone needs a wearable. I think I do like wearables for their ability to capture an aspect of sleep, for data to help people to see if there are certain problems. Certain disorders of sleep you can only really diagnose with some objective measures. Some movement-related disorders are really easy to capture here. You should be very skeptical of wearables that tell you what stage of sleep you got. So comparing REM sleep and deep sleep and light sleep, the algorithms that are in place to do the data analysis on this are not yet very reliable for this. You would really need an EEG overnight to be able to see those aspects of your sleep cycle. So you should be very skeptical of your light sleep versus deep sleep versus REM sleep on that. In terms of your total sleep time, they seem to be a bit better, so getting a general idea of your duration. The problem with wearables, or at least not necessarily with wearables, but the obsession with measurement of some health data, is something that we are now recognizing as something called orthosomnia. So this is where people engage in unhealthy sleep practices on the basis of trying to gamify their sleep scores. So they might fight against natural tendencies for when to get into bed to make sure that they maximize the score they get on an app or on a watch. So that is something that is particularly problematic because it goes against the natural inclination to recognize when you're tired, when you're not tired, to try and get a badge or something via an app. So that would be something to be aware of, but I don't think wearables by themselves are evil or a problem.
So that score that you get on your watch is not a reliable indication of whether you got good sleep or bad sleep?
Not as reliable as you should be yourself in recognizing, am I able to get up out of bed feeling well rested if I engage with the sun, if I get some sunlight in, if I'm able to perform at my job or studying before 12 without caffeine. That is a better indicator than a number that you see on a watch.
What are then the hallmarks of really good sleep? When I wake up in the morning, what should I be feeling? How should I be feeling in my head and in general?
So immediately in the morning, it's very easy to be tired regardless of when you wake up. Depending on what cycle of sleep you're in, or what stage of sleep you're in, I should say, when you wake up, that might impact exactly how tired you feel in the moment. So we see naturally when people are not obstructed by alarms or environmental factors, people tend to wake up after periods of REM sleep, similar to what we were saying about the weekends and remembering your dreams. So it could be just that you're unlucky that you wake up in a stage of sleep that then might make you feel a bit more groggy as you first wake up. The better thing to do is to wait until about midday and see if things have not gotten better from that tiredness. Because if that's the case, then that might be more of an indicator that you didn't sleep too well the night before. So don't be too worried about waking up feeling a bit tired, taking a while to get back, to feel like you're in the land of the living. That's quite normal. But just checking yourself sort of by midday, early afternoon, if you really are still experiencing that tiredness, that might be more of an indicator that your sleep wasn't so good.
So waking up tired is not necessarily a bad thing, does not mean that you had a bad sleep?
That's correct. It's not necessarily a problem.
Okay, all right. I wanted to do, as the last section of this video, just a rapid fire fact or myth.
Okay.
Because there seems to be a lot of misleading information on the internet, as we
Yes,
already saw.
Not only in sleep, yeah.
Yes. So I have just a few facts, which I'm not sure whether they're facts or myths, but
Okay.
you'll be the one to say.
We'll see.
Okay. You can train yourself to need only 4 to 5 hours of sleep.
That is not true. You can't train yourself. You might be somebody who needs less, but you can't train it. No.
Okay. Alcohol helps you sleep better.
No. It helps to knock you out. It helps to make you feel more confident when you're taking it. But no, it doesn't help you sleep. It helps to knock you out. Unfortunately, that's why hangovers are so painful.
Okay. Snoring is harmless.
That's a difficult one. It could be. So it could be an indicator of something like sleep apnea, but it could also just be, if it's not so chronic, then it's probably harmless to the snorer. It's probably less harmless to the bed partner of the snorer. But yeah, it could be.
But if it's related to sleep apnea, then it's not
Then
harmless.
it's something that, you need to get checked because you might need to get positive airway pressure mask or, something to put in your jaw to prevent yourself from snoring.
Okay. You can make up for lost sleep on weekends.
Yeah, not really. It's not the case that you cannot be chronically getting less sleep than you need throughout the week and then expect to sleep extra at the weekend. One thing that we do notice is that when people are sleep deprived, the following night, they tend to have more intense deep sleep that does seem to be in some way perhaps a compensatory mechanism. It's not the same as making up for lost time, but it might be a mechanism to try and protect you after a singular night of bad sleep.
Being on your phone before bed ruins sleep because of blue light exposure.
So this one again requires a bit more nuance. If you have had no exposure to the sun or to bright light throughout the day, that could be the case. If you've been outside, it seems like being on your phone beforehand might be less of an issue. However, blue light exposure does seem to be connected to people having lower sleep quality as they report it. But this is still quite a grey area of research, actually. We don't really know the exact extent to which blue light is the problem rather than you being on TikTok until 3 a.m., for example.
Oh, okay. So if you're watching really interesting reels, for example, you may be stimulated in a way that prevents you from falling asleep later.
Exactly. So this is something that we still don't really know where the interplay is exactly between the blue light effects or the fact that you're cognitively so stimulated. Okay. And would be a very interesting research question that hopefully we'll see more stuff of in the future.
Waking up during the night always means poor sleep.
No, we tend to wake up for small amounts of time as we come out of certain sleep cycles. Waking up for large periods might be indicative of bad sleep, but getting up into the night to go and use the bathroom or for 1 or 2 minutes usually is not even noticed by people when they have these sort of micro awakenings. But no, not all periods of wake in the night are indicative of bad sleep.
And the last one, older adults generally sleep less because they don't need as much sleep.
So the first part is correct. Older adults do tend to sleep less, but it's not necessarily because they need less sleep. So we see that one of the reasons we think that older people sleep less is because as our brains start to atrophy and cells die out, this tends to happen from the frontal lobes first. That is where slow waves are generated from. And so that might be one of the reasons why it's harder to initiate a lot of deep sleep. And that could be something that's related to awakenings throughout the night. So no, it's not the case they need less sleep, but they do tend to get less sleep.
Does this in any way accelerate brain aging even further?
It could be. If it's the case that you then are unable to, if it really impacts your sleep a lot, that would still come with all of the normal issues that we see for younger adults in terms of their health issues as well.
And I would imagine if you've had chronically less sleep in your 20s, 30s, 40s, once you reach your 60s, 70s, and you get those just 3 to 4 hours of sleep per night, that could be the thing that tips you over the top for dementia. Is that the case?
Yeah, I mean, for dementia, there's a large interplay of different things, but for any number of health issues, we know that getting less sleep is an issue. We know that there are, it's a bit more nuance for this, but there are more heart attacks that happen on the day following daylight savings time when we lose 1 hour of sleep, whilst the total number of heart attacks within the week after daylight savings time remains the same. The exact number of heart attacks tends to increase on the day after. So it seems to be that if you're in a position of ill health that you were going to have a heart attack or you're at high risk for one, losing even 1 hour of sleep might be the thing to push you over the edge to actually have one. So that's why we know that there is quite a strong interplay between individual nights of bad sleep if you already have a lot of poor health underlying that.
That's really interesting. Do you have any last words for listeners?
Yeah, I think
Anything
maybe
that
we
you
should
would
end on something a little bit more positive
Yeah.
rather than the heart attack thing. I would say I'll go back to the idea of that because sleep is a natural process. If you're not getting in its way, it will do its thing. So a lot of the things that we look at behaviorally for people is to try and stop them from engaging in behaviors that might make the natural process more difficult. One of the really great things about sleep research for sleep treatments is that we actually have really fantastic treatments that do work. We're not in the complete dark about what is involving with sleep and how to make it better. Whilst there's still plenty of questions that we don't know about sleep, one thing that we tend to know is that there are lots of ways to make it better. So if you are having problems, there's lots of advice on the internet that's already pretty good. But speaking to a doctor about it, there are really nice treatments that are available that are quite simple, that don't require medications, that people can undergo.
Yeah, that's a really good point. I think some people who suffer from any kind of sleep issues, especially insomnia, sometimes there tends to be this narrative of, oh, I have insomnia and I have to live with it. But in fact, you can go seek treatment and actually live quite well and go back to your normal sleep routine after some time.
Absolutely.
So yeah, if you're somebody who's suffering, no matter from what you're suffering from, PTSD, anxiety disorders, insomnia, anything, just look for help, and help will be provided.
Yeah, indeed. And if you're interested in the questions, then research careers are also a good way to sort of be at the forefront of working out how to improve these treatments. But yeah, there's help available, and there are still interesting questions to answer.
Thank you. Thank you so much for this conversation, and thank you for being here for the first episode of the podcast.
Thank you for having me.